Are there prevention strategies for extrapulmonary tuberculosis? When we think about tuberculosis, we often picture it affecting the lungs. However, extrapulmonary tuberculosis, or EPT, occurs outside the lungs and can affect various organs like lymph nodes, bones, and even the central nervous system. Understanding how to prevent EPT is crucial, especially since it often arises from pulmonary tuberculosis. Let's explore some effective prevention strategies. First, early detection and treatment of pulmonary tuberculosis is vital. Since EPT can result from the spread of bacteria through the bloodstream or lymphatic system, diagnosing and treating pulmonary tuberculosis quickly can significantly lower the risk of developing EPT. It is essential for patients to complete the entire course of antituberculosis therapy to prevent any progression or relapse. Next, vaccination plays an important role. The Bacillus Calmette-Guérin vaccine, or BCG, offers some protection against severe forms of tuberculosis in children, including certain types of EPT like TB meningitis. While its effectiveness in adults can vary, it remains a key preventive measure, especially in countries where tuberculosis is common. Another strategy involves addressing social determinants of health. Tuberculosis risk increases in conditions like overcrowding, malnutrition, and poor ventilation. Improving living conditions and nutrition, as well as controlling diseases like HIV, can help lower the overall incidence of tuberculosis, including EPT. Infection control measures are also crucial. Ensuring proper ventilation, practicing respiratory hygiene, and using protective equipment in healthcare settings can help prevent the spread of tuberculosis bacteria. This reduces the chances of new infections that might develop into EPT later on. Screening and preventive therapy for high-risk groups is another effective approach. Individuals with latent tuberculosis infection, particularly those who are immunocompromised or have close contact with active TB cases, may benefit from preventive treatment. This can help reduce the risk of progressing to active disease, whether pulmonary or extrapulmonary. Lastly, rapid and accurate diagnosis is essential. Advances in molecular diagnostic tools allow for quicker identification of tuberculosis and multidrug-resistant strains. This enables timely treatment initiation, which is crucial in preventing the spread to extrapulmonary sites. In summary, preventing extrapulmonary tuberculosis involves a combination of strategies. These include vaccination, early diagnosis and treatment of active tuberculosis cases, addressing social factors, implementing infection control measures, and providing preventive therapy for vulnerable populations. These strategies align with global health guidelines and are essential for reducing the burden of all forms of tuberculosis, including EPT. Always consult healthcare professionals for personalized advice and guidance on tuberculosis prevention.